is to know about the facts of microbiome, different types of prebiotic, probiotic, then where they are present, what they have role in our body, and what is their role in infertility, and then conclusion we will discuss. Now, a dictionary meaning of microbiome is it is the collection of all the microorganisms and viruses that live in a given environment, including the human body or some part of the body, such as digestive system, reproductive system. The human microbiome plays an important role in person's health. Female genital tract hosts large number of microbes, their number being more than that of actual number of cells. Now, learning about few facts. Our body is home to 100 trillion bacteria and other microbes, collectively known as microbiome. Naturalists first became aware of our invisible lodgers in the 16th century, but it was not that until past few years that we have now become really familiar with them. The recent research has given the microbiome a cuddly kind of fame. We have come to appreciate how beneficial microbes are for us. They break down our food, they fight against infections with us, they nurture our immune system, they help in early healing of the wounds, they improve our mental health, and they maintain our body hormones. Just let me do this hide. It's a lovely invisible garden in there, and we should be tending for our own well-being. Change in microbiome can interfere in various functions of our body. So, considering about vaginal microflora, what they do, lactobacilli are the dominant microflora of the vaginal system. What lactobacilli do? The lactobacilli, they make a biosurfactant, a film kind of thing on the surface of the vaginal mucosa, and they produce lactic acid, hydrogen peroxide, and acetic acid. And they also produce the bacteriocins. So what happens with the biosurfactant? It inhibits the adhesion of the pathogens on the mucosal wall, and lactic acid and other acetic and acid which are there, they maintain the acidic pH in vagina, which in turn inhibits the growth of the pathogenic bacteria, and bacteriocins obviously will kill the pathogenic bacteria. So now the crosstalk between human cells and microbes play an important role in maintaining sanity and normal function of healthy cells, as well as help in achieving homeostasis at the molecular and cellular level. Microbes are essential for human reproductive health. Now, what is microbiome? Every bug or microbiota, we call it, all of their genes and everything they produce in total is called microbiome. The ratio of normal cells to microbiome is either it is 100 to 100, or sometimes in some cases it is 3 times more than the normal cells. It is an organ in itself that basically works as an ecosystem in our body. It is also known as our second gene. Everyone has different microbiome, though the species of microbes can be same. So their concentration here and there will be different at different parts of our body. So everybody will have its own unique microbiome. So now to understand few terms, what is prebiotics? Prebiotics are the live microbes. Probiotics are live microbes. Prebiotics are the food for probiotics, and symbiotics are combination of both pre and probiotics. So what are probiotics? Probiotics are live microorganisms that are intended to have health benefits whenever we consume them. They can be found in yogurt and other fermented foods and our dietary supplements. These are combination of live beneficial bacteria or yeast that naturally live in human body. Bacteria is usually viewed in a negative light as something that makes you sick. However, you have two kinds of bacteria constantly in and on your body. There are good bacteria and there are bad bacteria. So let us know what are the bacteria which have good role or a positive role in our body. One is the bifidobacteria. Various strains, they help to regulate other bacteria in the gut. They modulate your immune system, and they prevent the tumor formation, and they produce various vitamins also. Then lactobacilli, several types of lactobacilli live in the gut and are involved in production of vitamin K, and which is essential for blood clotting, and they also help to keep the bad bacteria in check. And some strains, however, can lead to illness also, but most of the lactobacilli are favorable for us. Then E. coli, it is a beneficial strain. It produces vitamins, nutrients, and they boost our immunity and protect us against carcinogens. However, few E. coli strains are pathogenic also, but most of them are beneficial. Now, bacteria with the negative role is the Campylobacter, then Enterococcus faecalis, and Clostridium difficile. The Campylobacter jejuni and C. coli are the strains which mostly associated with human disease. Similarly, these rest of these two are also associated with the disease. Whenever they proliferate, they always do harm to your body. Now, life has survived for more than 3 billion years because it is robust, and almost no mutation can easily outwit the strong defense which is created by nature for us. Now, coming on to the reproductive system, and first of all to the vaginal microbiome. The normal physiological vaginal microbiota was initially described in 1892 by Albert Dodelin. It is homogeneous, consisting of only gram-positive bacilli, which were named after him as Dodelin's bacilli. Believed to originate from the gut and currently known to be a part of genus Lactobacillus, the composition of the vaginal microbiome is dynamic and undergoes changes corresponding with our hormonal fluctuations throughout the woman's reproductive life, right from the puberty to menopause. And during pregnancy, the vaginal microbiome will accordingly change positively for us. Now, the physiological status of vaginal milieu is important for successful reproduction. The high estrogen states, as seen during puberty and pregnancy, acts by stimulating the maturation and proliferation of vaginal epithelial cells and the accumulation of glycogen. A glycogen-rich vaginal milieu is a heaven for the growth of lactobacilli. They secrete lactic acid and make the pH acidic, and also produce bacteriocins and biosurfactants to protect the cervico-vaginal environment, as we just discussed. Now, coming on to uterine microbiome. Long back, it was thought that uterus is a sterile organ, and there is a mucus plug in the cervix which prevents the ascent of the bacteria or any pathogens from the vagina to the uterus. But now the concept has changed. It has only been recently confirmed that uterus is not a sterile organ at all. This is due to the improved detection by the RNA gene sequencing techniques, which can even detect very low number of bacteria which you can't culture. So there are three types of bacterial population in our uterine microbiome. One is the residents, which remain there and they are normal and they help in keeping the homeostasis at the level of the endometrium. Then there are tourist bacteria, those which can be eliminated easily by your body or maybe by drugs. Then there are invaders, which are responsible for producing the disease. The uterine microbiota and specific bacterial species may be linked to critical health issues such as endometriosis, endometrial cancer, and it affects the IVF success rates also. For optimal success, future studies required to elucidate interactions between the uterine microbiota and host in the context of women's reproductive health. Specific species or microbiota compositions may provide indicators or predictors of the disease. So now what is our dilemma? Our dilemma is that despite growing evidence of presence of microbiota in the uterine cavity, still there is no consensus on the endometrial bacterial core. Further studies are required to help us understand the physiological uterine microbiota as well as how dysbiosis could impact our clinical outcomes in the pretext of reproduction. Then importantly, the responses from the host may be varied, and it is also modulated by many other aspects which affect the human conception. A physiological and healthy endometrial microbiota should be considered a group of microorganisms that is permissive for embryo implantation and live birth regardless of the minimum presence of pathogenic bacteria there. Now, you will be astonished to see that in the vagina alone, 581 bacterial types have been cultured from the vagina only. You can see in this figure 581. There are so many names, you just can't even remember them. Now, when the baby is born, baby doesn't have much of the bacteria outside, but when the baby passes through the vagina, its microbiome formation starts there and then only, from the as the skin is smeared with the vaginal microbiome. Now, microbiome and fertility. Microbiological composition and environment of vagina greatly influences the fertility and outcome of ART. Bacterial vaginosis has been associated with poor pregnancy rates in IVF cycles. So this is a known fact that there will be, if there is vaginosis, then the pregnancy rate will be less. Now, what are the factors which predispose for vaginosis? First and foremost important is multiple sexual partners. Exposure to increased numbers of male sex partners or having a recent change of male partner increased the risk of developing bacterial vaginosis 1.6-fold high. Then excessive douching. Some women are really finicky and they keep on cleaning the vagina every time, watching the vagina, douching the vagina. That is also not good because that will remove the normal protective lactobacilli from there. Then cigarette smoking, poor hygiene, previous sexually transmitted disease. Bacterial vaginosis is more prevalent among the women with a prior or current sexually transmitted disease, although the STIs and BV commonly coexist, particularly the trichomoniasis and bacterial vaginosis, but still we don't consider bacterial vaginosis as a sexually transmitted disease. Then intrauterine devices, that the presence of thread there may lead to infection and later on to bacterial vaginosis. Now, what is important to understand that the 50% of the women with bacterial vaginosis are of course asymptomatic. So absence of discharge does not imply the absence of bacterial vaginosis. So this is very important to understand. Even if you find on PS that vagina is very clean, there is no discharge, patient is not complaining of discharge, and still you are not getting IVF results, that does not mean that vagina did not have bacterial vaginosis. So now coming on to the review of literature. So I found many studies on microbiota, and most of them are after 2016 or 2017. So this was one study which I found. There they have shown that among 33 women who became pregnant, the best results of implantation were observed during the colonization of the uterus only with the Lactobacillus genus, both in fresh and frozen thawed embryos transfers. The overall pregnancy rate was 36.4% after the colonization of the uterine cavity with the Lactobacillus genus, whereas in the sterile uterine cavity, the pregnancy rate was only 9.5%. So you see the tremendous difference. 36.4% pregnancy rate, and in a sterile uterus, you get the 9.1% pregnancy rate. Whereas high frequency of isolation of Bifidobacterium sporidus in non-pregnant suggests that this is also having a possible negative effect and making it to 9.1%. Then this was a review of 5-6 studies, and in various studies they have taken the minimum number of patients were 37 and maximum number of subjects were 342, and they concluded that non-lactobacillus population was associated with poor pregnancy. In almost all the 5 studies, the same inference came out, that there was a significant difference in when the lactobacillus population was there and when the lactobacillus population was there in the pregnancy rates. Now, this was another study where the endometrial microbiota of women with or without a live birth within 12 months after a first failed IVF cycle was done. This study was done at various centers around the world, and they concluded that IVF ICSI success may be associated with lactobacillus crispatus secondary infertility with endometrial dysbiosis more than the primary infertility. These hypotheses, however, they said should be tested in well-powered further studies also. So still, after every study, you find this quote that this should be further studies, and we should have further powered studies or further randomized controlled trials to prove the fact. But here you will see that lower implantation rate is there whenever there is low abundance of lactobacilli, and high outcome is there, IVF better results are there when you have dominant lactobacillus microbiota. So these studies together suggest that uterine microbiota may play a significant role in reproductive success, and the dysbiosis of this microbiota biosis of this microbiota may compromise conception or implantation and increase the pregnancy loss also. So now we all will be confused that how to diagnose, because we say that whenever vagina is clean, everything is clean, and still it is not good for us. So how do you diagnose? We all do whatever tests we do for the vaginal KOH preparation, then your Nugent score and M-cells score, etc. So, but specifically to find uterine microbiome, what we need to do? This we do by the endometrial biopsy. The test is called EMA test, which tells us the endometrial microbiome to help identify the abnormalities which are associated with poor reproductive prognosis. It indicates the endometrial microbiome balance, providing the information on those linked to higher pregnancy rates. EMA also included ALICE test, which detects the pathogenic bacteria that can cause chronic endometritis. So what do? We take endometrial sample. From the endometrial sample, DNA is extracted. Then after DNA extraction, the next gene sequencing is done for the analysis. Then a report is there, and then you treat the patient. Now, EMA is the test which is called the endometrial microbiome metagenomic analysis. It just looks at the endometrium's microbiological conditions and its ecosystem, but EMA is aimed at the woman with recurrent implantation failure or pregnancy loss or poor reproductive outcomes every time. Even if you are putting a very good embryo, good ET you are seeing, and still you are not getting the result. Those are the patients. Then endometrial sample is taken between 15th to 25th day of the cycle, and you can even take it with the ERA test if you are doing ERA test in that particular patient. It is, however, not planning the ET day as we do with the ERA. This is just that you find that the endometrial microbiome is not healthy, and you just treat the patient and then do the ET maybe after 2-3 cycles or so. It is not like ERA that it plans the day for you for the ET. Now, how to manage these cases? It is very difficult first to diagnose, then to manage. Then this thing is also very important, that seminal fluid generally have not demonstrated abnormal pathogens, and studies have not shown any relation in abnormal microbiome with abnormal semen. So it is very uncertain to treat with probiotics to improve the poor semen parameters. So we may not think that if we are improving the endometrial microbiome and giving the probiotics to the wife, we have to give it to the husband also. It is still uncertain. If the semen parameters are not good, they won't improve with the probiotics. So objective of treatment in female is not only to treat the infection, but also to restore the healthy microbiome. So a biofilm group of microorganisms this is, again, I think this has come up again. Maybe the slide sequence has gone wrong. The group of microorganisms, they stick to each other and to surface embedded within a slimy extracellular matrix composed of extracellular polymeric substances. Bacteria within the biofilm are not effectively eliminated by the immune system or are not fully destroyed by the antibiotics. The biofilm related infections, they tend to persist. So that is why if lactobacilli are present, they have already created a film there. So these bacteria will not affect in those patients. I'm sorry for the sequence going wrong. The focus should be on the restoration of the healthy microbiome. So what probiotics we need? The probiotics, when orally administered, have the natural ability to migrate to the vaginal region from the intestine via perineal and vulval skin also. Then probiotics maintain the vaginal pH to less than 4.5, that is acidic, thereby not allowing the conductive environment for the growth of the pathogenic microbes. They produce lactic acid, and then acetic acid and hydrogen peroxide, and have antimicrobial activity. Lactobacilli competitively block the adhesions of pathogens to the vaginal epithelium, thus preventing the spread of infection. Production of bacteriocins that can also inhibit the further growth of pathogens. In vitro studies have shown that lactobacillus strains can significantly disrupt Gardnerella vaginalis biofilms and inhibit the growth of pathogens. So what are the drugs, or what are the probiotics which we have? We have Lactobacillus crispatus, Lactobacillus gasseri, then Lactobacillus plantarum, reuteri, rhamnosus, then Jansseni, then again Acidophilus, then Casei, fermentum. So there are so many, but the important is that whatever preparation you are giving, they must have Lactobacillus reuteri, rhamnosus, and crispatus. These are three important. If they are present in that particular combination, then that is a good preparation for you to use. So we have oral different preparation, 10 billion twice a day for 2 months we give, and then we give 1 tablet 1 month. So treatment is for full 3 months. Then there are vaginal probiotics also. They are given in same strength, but the dose is once a day for 3 months. We don't give it twice a day as we do in oral ones. Now, empirical use. It can be done empirical use if we do not have facilities to test and patient is a case of recurrent implantation failure or has poor unexplainable outcomes, especially in obese and diabetic patients. So there is no harm in giving simultaneously probiotic also for 8 to 12 weeks before your next cycle. So to summarize, microbiota is important part of our reproductive tract, especially genus Lactobacillus, which is associated with good results. There is definite relationship between the reproductive tract microbiome as a cause of infertility and outcome of ART cycle. We must do vaginal examination, do culture sensitivity test, PAP test before recruiting the patient for IVF. Routine use in poor outcome patients is definitely recommended. We must use preparations with 10 million colonies at least, but there are preparations where they are giving 1 billion or 10 billion, that is 1000 million colonies. But here we don't have. Microbiota is in, this is I think same repeat. So thank you, that was it.